2017, Salina Regional Health Center became a certified primary stroke center. May is National Stroke Month. I'm Dr. Jeremiah Ostmeyer, emergency physician and stroke medical director at Salina Regional.
Well, Doctor, thank you so much for being on the show. May is National Stroke Month, so wanted to have you on here to talk about strokes. Let's start out, talk about the prevalence of stroke here in town.
Yes, Mike, thanks for having me. National Stroke Month is always a good reminder to bring stroke to the forefront and talk about it some more. As you know, it is one of the top 5 leading causes of death in our country, in our region, and locally, and the #1 cause of debility in our country. And it's a scary diagnosis for all of our patients out there, and we work hard to do our best to bring it to the forefront and treat it with attention that a time-critical diagnosis like stroke deserves.
So let's talk about some of the warning signs of stroke.
Yeah, absolutely. It absolutely is a time-critical diagnosis. The faster we recognize it and get patients in to see us, the better outcomes we have. Everyone has heard of the FAST algorithm we like to use out in both our ambulances and patients out in the community. Acronym standing for F for facial droop, A for arm drift or arm weakness on one side of the body or the other, S for speech changes, and T for time to call 911. If you have any of these symptoms or signs, it's important that you get help as soon as possible and come see us at the hospital.
Okay, let's take a look at what you do then once the patient's in the door.
Sure, we often meet them at the door, even outside the door in the ambulance bay, starting taking our history, which is key, and asking a few key questions on the presentation, when the symptoms started, what exactly is going on, how the patient's feeling, and they often will go immediately to the CT scan and get a CT scan of their brain within minutes of arriving at our door. That's always our first initial screen for these stroke patients. And then they'll go to the room and be overwhelmed with the attention they're getting from multiple stroke-trained nurses, emergency physicians, neurologists, ED pharmacists. So there's a whole team of us that is prepared to take care of these patients.
You'd mentioned the CT scan. Is that for confirmation of a stroke or to determine what type of stroke they're having?
Yeah, good question. So the CT scan is our initial diagnostic test. It will help us determine what type of stroke a patient is having, bleeding hemorrhagic stroke versus ischemic stroke. The hospital has recently purchased a rapid AI software that helps us more quickly delineate what type of stroke a patient is having and further assess what type of treatment they need. We're on the cutting edge of stroke treatment with this rapid AI, and it's exciting for patient care in this region.
Okay, well, thank you so much for being on the show. I will once again repeat, FAST, face, arm, speech, and time. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, and follow us on Twitter and Instagram.